So yeah, we have collaborated a lot actually with in the East Midlands region. So we've worked with the University of Leicester, with Medilink and with AHSN. And I would definitely recommend that to anybody if there's any innovators in the audience, because we found that help invaluable. So the last thing I need to do before I actually go into my slides is to tell you I'm not a data scientist. So I'm coming at this as a lay person. So the problem that we are trying to solve is medicine shortages. So I'm hoping that everyone in the room has actually heard of medicine shortages, given how much press coverage shortages get in the UK and everywhere in the world. But they are a recognised major health concern. So they're on the increase globally, occurring every day and impacting everyone involved in patient care. And in fact, they result in millions, if not billions, of pounds in wasted healthcare resources across the world. And most importantly, they affect patients. So delays or interruptions in treatment, and there are even cases of deaths because of medicine shortages. So this is a huge global problem. So I'm a scientist, not a data scientist. So the first thing for me when we were looking at this problem is actually to go and understand and research what the data is, talk to people who are involved in this, so pharmacists, wholesalers, manufacturers, etc., and get their views and see what else has been published in the area. And what you find is actually data is a real problem when you come to medicine shortages. And here are some of the quotes. So the European Commission, they had a study with IQVIA, who are, from a healthcare point of view, the gold standard in terms of data. And their conclusion was proper understanding of shortages remains substantially challenged by the lack of data. So first problem. The second problem is related to that, in that actually pharmacists consider improving access to information and data the best method of dealing with shortages. So one group is telling us we haven't got it, and the second one said we really, really need it. And then the other part is even the data that we have, pharmacists don't necessarily get access to it. So this is a European study, and what hospital pharmacists said is that 70% of their IT systems didn't automatically feed them information on shortages, and actually 48% said actually even when they got it, it wasn't actually very much use, which isn't great when you're talking about medicine access. So just to give you a real world example of this. So I'm sure that everybody here heard about the amoxicillin issues in the UK. And this, in the public domain, is how that situation occurred. So first of all, professional bodies that represent hospital and community pharmacists started to get reports in November about issues with accessing amoxicillin. However, the UK Security Agency issued a recommendation to prescribers that in December, so many weeks after the shortages started to occur at a pharmacy level, that actually to promote the prescription of penicillin and amoxicillin because of the issues with strep A that we all know about. By the 5th of December, there were widespread reports in the normal press. And once it gets to that level, you're in a really serious situation, actually, because once people start hearing about there's a shortages, what do you think the natural human behaviour is to do? It's exactly like toilet roll and COVID, that people think, oh my God, I can't get any of this. Therefore, if I can get it, I'm going to get it. However, the government and the Department of Health and Social Care stepped in and they said, no. And in fact, even Rishi Sunak stood up in Parliament and said, no, there are no shortages of amoxicillin. Actually, and all the pharmacists actually threw their arms up in the air and said, well, we can't get hold of it. On the 8th of December, the chief pharmacist of England sent a letter to the pharmacists around the country saying, no, there are sufficient supplies, you shouldn't be panicking. However, they had to turn around and do a U-turn because on the 12th of December, they issued a medicine shortage notification. So that's the highest level of shortage situation in the UK. If you get to that point and they issue a serious supply notification, that means, okay, they've acknowledged there's a problem. And on the 14th, they banned exports of the product, so they were trying to avoid it going out of the country. And on the 15th, they offered a further, well, the 15th and the 16th, a further 8 shortages. So you had a situation at the beginning, pharmacists saying there's a problem, then the government and the health service saying no, there isn't, and then them having to turn around and say yes, there is, and try to intervene. Now, the interesting thing about this, and the reason that actually, when you think about data, we need to look at things internationally and not nationally, is actually the first shortage of amoxicillin occurred in June in Australia. And in fact, the amoxicillin issue went around the world. And if we'd have been looking at this, we didn't even need analytics or AI to see this, actually. So obviously, the cold season in Australia is 6 months before the cold season in the UK. And you know, they therefore had a big increase in infections and then an issue with supply. And actually, with this information, hopefully Rishi Sunak wouldn't have stood up in government and embarrassed himself. The Department of Health maybe could have looked at it and said, you know what, this is a problem that's coming our way. We could be issuing advice to prescribers about different products because we know that there are global supply issues with amoxicillin. But none of this really is ever taken into consideration. So what are we trying to do about this? So what we are trying to do is to be the first company or organisation to consolidate information from lots of different data sources and create our own data about what really is happening from a shortage perspective. And this is actually a really complicated problem. So you have, in most countries around the world, a national shortage register. And the information that's published in that is usually pretty scarce, actually, and it's not consistent from country to country. But we think as a first point, we should be able to consolidate all of that information. So we're developing natural language processing to be able to take information from different countries, because everybody calls medicine something different, et cetera, to be able to understand what's happening on a product basis in terms of shortages around the world. There's some information that you can collect from public websites or pharmaceutical websites, generic websites, etc. So that's part of our data collection activities. And there are also professional reporting. So actually, when a shortage occurs, it's the pharmacist, when they can't get the product, is the first point that you know about it, which is clearly a little bit too late, but we're interested in collecting that information. We're also looking at NHS prescribing data and NHS procurement data to look for signals that in the data, so using development of algorithms, etc., to see that in the past, when we know that there were shortages, can we see if there are any signals there in terms of predicting going forward. We're looking at social media, because pharmacists tend to complain on social media about shortages, but we're also doing it through our platform. So the problem with the national registers is that they're the tip of the iceberg. They are shortages that have had a national impact, but actually there's a huge iceberg underneath that of shortages that happen on a regional issue, and we need to understand the full picture if we're going to try and address it. So that's all I'm going to say. I think that if we there's questions after the session, so I can hand over to the next person. Thank you.